Since this initiative began, Ontario has already attached over 275,000 new patients to a primary care clinician, putting the province on track to meet or exceed our target of connecting 300,000 new people to care in 2025 and every Ontarian to a primary care provider by 2029.
When we last heard from the health minister, she had said that the government had planned to have everyone that's on the Healthcare Connect wait list, what was 235,000 Ontarians last year that were on that wait list, that had been reduced or has been reduced to 177,000 at this point. That's 75% of its spring target. Outside of that wait list, that many more people have been connected, or attached is the word that the government is using. They have attached people to primary care teams. Now, that isn't family doctors necessarily either. Those teams are made up of different health professionals, including doctors, nurses, social workers, dietitians, and some of those clinics perhaps that are in place, as was brought up in the questions and answers during the course of the press conference. Some of those clinics are actually led by nurses and not necessarily those primary care doctors. So they're expanding the primary care teams. They say that now there are fully operational teams that have served almost 500,000 people over the course of the last year. And according to new data from a group of primary care researchers that was made available by the government for the first time today, as of September, there were approximately 1.9 or close to 2 million people not attached to primary care in the province. That is actually contrary to what the Ontario Medical Association and other healthcare professional organizations have said. They've said 2.5 million before this at last check, and that number that had been matched were just 11% of the total number of people in this province without a healthcare professional. I had a chance to speak with the president of the OMA not too long ago, and here's what she had to say.
Firstly, we have to look beyond this list. We know that there are a lot more people, the rest of the 89%. So we need to be focused in general on the numbers that we know are correct. Secondly, we need to have further funding towards helping the physicians, especially with its primary care teams, to help support them.